They have been demonstrated in many, many studies in labs across this country and in the world to have effects in animals, in petri dishes, and in small recent human studies to actually arrest the growth of many types of tumors. Breast, brain, lung, blood, pancreas, and you name it. Quite impressive. There's probably three mechanisms that we think that are generally involved. Number one is stopping the blood supply, the new blood vessels. When they go to solid tumors, to have a solid tumor grow, it has to have new blood vessels. And tumors release chemicals to make blood vessels grow to them. Cannabinoids seem to interrupt that chemicals process. It's called anti-angiogenesis. Cannabinoids cause tumor cells to kill themselves, programmed cell death, and pro-apoptotic, that's what that's called. And they seem to also prevent the invasion of a tumor through a tissue, which is a process by which solid tumors metastasize. So those are some of the things that research has shown cannabinoids the ways in which they can have anti-cancer properties. And this is not just sort of fringe science, somebody in some lab someplace, so it's not been replicated. It's been replicated over and over. And the National Cancer Institute, which is the world's largest funder of cancer research, has collected information both for patients and health professionals and put it out to the public on a place called the Physician Data Query, Cannabis and Cannabinoid Health Information Summary. And you can go to this on cancer.gov, which is our taxpayer-funded public website.
Very nice.
Yeah, it's nice. And so if any of you doctors out there, or patients, look at this stuff. It's vetted. It's peer-reviewed with a board. I was actually a member of the editorial advisory board, and I've submitted some of the material there. But it's been growing. It's a solid resource. So cannabis and as a potential anti-cancer agent is very exciting, and we need lots and lots and lots of research and trials to really figure out what variety, what kind, how much, for what condition. And I think I do believe that doctors and patients can do this together under supervision, medical supervision, so that they can track changes. They can kind of try to figure out what things there might be out there in terms of ratios that might be needed, how much. It's not. I think it's an experimental treatment that's necessary for people's sense of hope. And also, it's not just as a separate treatment, but potentially these cannabinoids can help to make standard chemotherapy radiation, which is our standard treatments in cancer in most of the world, modern medicine. It can help them become more effective. And that's been shown maybe in animal studies where they use a drug that treats pancreatic cancer. It's called gemcitabine. If you have some cannabinoids on this, you can increase the killing power of that. At UC San Francisco, they recently did a study where they used temozolomide, which is an oral agent for glioblastoma, a brain tumor that killed Senator Kennedy. They combined that with a THC CBD 1-to-1 extract. So, and I think the study is done. We're still waiting to see what the results showed. So it's not just a separate treatment, but potentially as a complementary treatment to standard therapies. And then aside from all of that, aside from treating cancer, having anti-cancer properties, there's tremendous data that shows that cannabis and integrated cannabis therapeutics into cancer patients' treatment can help to palliate or cloak symptoms of cancer and its treatment effects. So it's like pain, nausea, vomiting, loss of appetite, anxiety. So it's those are pretty, and I think impressive too. I think these are very powerful negative symptoms that people face, and when they face those, they don't feel like doing further cancer treatment. Certainly they can lose a lot of meaning and purpose in their life, so there's a lot of spiritual and existential distress when you face an illness that can be potentially fatal or is in many cases. So I think there's also a role for palliation of those kind of symptoms as well. So cannabis and cancer, that's a little bit of it. Cannabis and post-traumatic stress disorder, PTSD. It's also a very up-and-coming, exciting area, and we really have only scratched the surface. But I think we're going to get more information as more research continues in this field. But many people have attested to the fact that so what happens in PTSD is there's certain parts of your brain, one called the amygdala, which is involved in fear conditioning. It's basically kind of short-circuited. You have these triggers that put you already into this panic mode, fear conditioning mode, and this can cause nightmares, flashbacks, can be very disabling, night terrors, anxiety, irritability, et cetera. And I think we've had a lot of that in our, not just the diagnosed PTSD, but I think a lot of trauma in our society. So anyway, I think what people are saying is that, and this has been shown in animal studies too, is that cannabinoids can help with what's called the extinction of aversive memories. This is a fancy way of saying that, so that cannabinoid system, the endocannabinoid system I was telling you about, is involved in the way in which our brain lays down memories and associates certain emotions with those memories. And of course, the amygdala is a sort of fear and emotional regulation center. If you have extreme fear associated with memory, that memory they're just linked together. When you bring that memory up, an extreme amount of fear will come with it. And so cannabinoids can potentially disrupt that aversiveness of that memory and potentially help people get out of that cycle. It's not the only exciting treatment out there that's coming up that I'm really interested in. I think the use of MDMA, or what's called is called ecstasy, as a treatment for post-traumatic stress disorder and other forms of what's called psychedelic psychotherapy may be really promising as well. And in those cases, you might just need a few sessions to have long-lasting effects. But I think cannabis, because of its ability to really work gently and slowly, will be a great salve for these symptoms as we continue to use it. Many states have now approved. As you know, California had the first medical cannabis law, and there was no condition diagnosis. Many states after that had condition lists, and in many of those states they have since added PTSD or put it in from the beginning because there's so much excitement, especially from the military community, veteran community. And I think that would be a really excellent if people start to understand what their body chemistry and their condition, what way that cannabinoids and what type of ratio will work best for them. In some cases, it might be a high CBD because of the anti-anxiety property of CBD, or it might be a 1-to-1 CBD to THC or some other variation. So the medical approach to this is not a one-size-fits-all, because our body chemistries are all different, and the endocannabinoid system is so vast. But I think the fact that the endocannabinoid system is so intricately involved in the parts of the brain where PTSD we think is taking a hold gives us a lot of hope. There actually was a study at NYU recently where they showed in brain imaging that the endocannabinoid system is upregulated in those patients who do have PTSD, meaning it's sort of ready for more input. It's our body's way of having to deal with this, trying to deal with it on its own, is to try to sort of jumpstart the area in the brain that helps us forget those things, but sometimes we need some medicine to help push it along. So that's a little bit of cancer and PTSD. Do you have specific questions about that?
No, I don't. I think you got that covered very well. I do have a question on, can we discuss your thoughts on the safety of medical cannabis compared to over-the-counter drugs?
Sure. Yeah, I mean, the safety issues, of course, is what originally the government said that we had to get rid of this plant for in the first place. They said it would lead to homicidal mania if we used it. So that's kind of I think there's been a lot of politics and misinformation around the safety issues around the use of cannabis. But I think, let's be real. We don't have any first of all overdose. You cannot die from using cannabis. Period. Full stop. It's not lethally toxic to the body. You can't give yourself schizophrenia in using cannabis. You just can't do it. There's some concern in certain vulnerable young people who may have certain genetic predispositions that use of cannabis may trigger earlier onset of a chronic psychotic disorder. We don't know if that's if there's a causal link there or if there's just an association. So it's a little bit hard to say that, but I think certainly caution should be advised in people who have some pre-existing psychotic disorders, personally or in their families. Doesn't mean that there's no role for it. There's actually some really interesting data on CBD being as effective as a drug called Ensocry for the treatment of chronic schizophrenia. That was in a head-to-head clinical study in Germany. So it's not that, I think, there's so many types of cannabis. So maybe for those kind of patients, Seizures cannabis might not be as safe or as helpful as CBD. So, but anyway, the other thing is, so I talked about that. I talked about chronic psychosis. You're not dead, but you're permanently psychotic. That would be a concern, and we don't have any of those kind of data to make those kind of claims. The other thing would be end organ damage. Is cannabis going to cause my brain to shrivel, my kidneys to not work right, to not filter enough blood properly? Will it cause my liver to go into failure? The answers are no, no, no. And there's plenty of reasons to believe that acetaminophen, Tylenol, can cause liver failure. In fact, it's one of the leading causes of liver failure in this country. People just don't know. They've tried to reduce the amount of acetaminophen in many drug products to reduce that. Ibuprofen can cause your kidneys to shut down and cause people to have to start to go on dialysis. It can be that bad. When people are taking lots of what they call NSAIDs, they can also have bad impacts on the stomach lining. So these are over the counter. All of these, and they do carry significant risks to the end organs. We just haven't seen that in cannabis. So there's really no need to track your end organ functions like through metabolic panels or blood tests. If you are taking other medications that are potentially toxic or have a narrow therapeutic window, like lithium or like certain anti-seizure drugs, there is a reason to think that maybe certain types of like CBD can maybe change the way that drug metabolizes in your body. So we have to maybe check the level of the drug and make sure your blood level is staying the same, or maybe even lower the dose of that drug so to keep the blood level the same, because that's called a drug-drug interaction. That's not very common, but I do want to mention that since there's all kinds of medical situations that people might have. So that's a little bit about the safety.
Well, thank you so much, Dr. Aggarwal, for this very informative presentation benefiting Shasta County. Canna will be concrete. Now we're going to have for the question and answers all of Dr. Aggarwal, and they're going to need to get ready for this because I'm sure there's going to be a zillion questions for you. Thank you so much.
Thank you so much, Dr. Tammy. I look forward to the Q&A. You guys have a nice day. Bye-bye.
Thank you so much.
All right then. So I caught my breath now. I talk a little better. I've been running around since, 5:30 this morning, and I went to bed at 2. Okay, so we're going to take just a couple second break to reset this up. What we're going to do is we are going to get him and us together live. And if you have some questions, okay, we're going to get them answered. All right? And we will get them answered by the doctor himself. So if you have some questions, let's get on with it, all right? We're going to take a 5-minute break. We're going to get him up here, and if you have questions, come on.
No problem.
Are you taping?
Yep.
Oh my goodness, I'm so
It's okay.
I'm gonna take my hat off.
It's okay.
All right.
Very good.